Good morning, everybody. I would like to present my progress about my PhD topic about the biotechnological improvements in clinical hemato-oncology. My name is Ádám Szilágyi, and my supervisor is Miklós Garami, and my scientific methodology supervisor is Fői. As a biologist, I would like to provide new therapeutic solutions for hemato-oncology. But first, I would like to show a big picture about novel therapeutic solutions, CAR T cells utility on a clinical level. For that, at this moment, I'm working on a comparison between the CAR T cell versus the conventional therapy in hemato-oncology regarding their efficacy and toxicity. For further investigation, I would like to compare these CAR T cell products with each other, and not just in efficacy or the safety, but also the cost effectiveness. Going back to my first project, I would like to finish it in May, and let me dive into these details. Despite the fact that we had a huge development in the last few decades in the oncological treatments, still 1/3 of the patients couldn't respond for the first few lines of therapy, and also 15% still pass away. They need novel approaches, and for example, the chimeric antigen receptor, the CAR T cell therapy, would be a great solution for them. Our aim is to identify that which oncological patient groups benefit the most from CAR T cell therapy, of course with the least side effects. Also, I have to mention that this is an autologous treatment, which means that the patient gets back his or her own blood cells after gene editing in vitro. And after that, we expect the side effects, for example, fever, or a very special, in this therapy, a very special cytokine release storm, which has flu-like side effects. So back to our question, we asked that, does the application of CAR T cell therapies change the rate of toxicity and affect the efficacy compared to the conventional cancer treatments? And of course, our hypothesis says that it does. So we examine hemato-oncological patients, and we are looking for outcomes about response, about survival, and we will check the RECIST and the CTCAE ratings too. At the first day of December, I conducted a systematic search in 3 different databases, and I found 19,000 articles with the domains of cancer, CAR T cell, and efficacy toxicity. Right now, we are over the duplicate removal, and we are doing the titles of selection, which will be finished soon. So, in the continuation, I would like to compare these CAR T cell therapies with each other. Let's see why. The FDA already approved 5 different types of CAR T cell therapies against 4 different kinds of cancers, which you can see here. We have to mention that this CAR T cell therapy is a tremendously expensive therapeutic agent, but still, in the long term, patients could be more beneficial, for example, because of the lack of, relapse. So our aim is to find out that which currently used CAR T cell products are the most beneficial for the patients in a long-term scale. So we ask that, does the type of CAR T cell products affect the efficacy, toxicity, and the cost effectiveness of the therapy? And of course, our hypothesis says that it does affect it. And for that, we will examine again the hemato-oncological patients, and also regarding the outcomes. We will not just see the responses, we will not just see the toxicities, but also we will check the cost effectiveness. For example, the cost, mentioning the financial background, and the ICER, which is incremental cost effectiveness ratio. For that, I made a systematic search in 3 different databases, and I additionally to the outcome domains, I added some search. I added some keywords for mentioning the hospitalization and some financial important words. I found 17,000 hits, and we are facing again the duplicate removal soon. Summarizing my aims, firstly, I would like to check the difference between these CAR T-cell therapy and the conventional therapy lines. And then I would like to finish it in May. And then I would like to further investigate these CAR products and check the difference between each other. And I would like to finish it in August. So, closing my presentation, I would like to thank you for your attention. And I would like to quote from a Dutch neuroscientist who said that we must accept that the fact that it is possible we know something without knowing why we know it.
Congratulations for this interesting and well-prepared presentation. And I have a question I haven't heard about in the presentation, but do you know when will this CAR T-cell therapy start in Hungary? Because if I know that it isn't available yet, I mean in the practice. Thank you.
Thank you for your question. Well, in the before presentation, Petra mentioned that they will examine it, and it's going to be soon. It's going to be soon available in Hungary, in a Hungarian hospital. Yes.
First of all, congratulations on your presentation. On your second project, you showed that only hematological malignancies are treated right now. So, do you know why they don't have data, or why don't they use it in non-hematological diseases?
Thank you for your question. So, right now, the problem with the solid tumors is the different microenvironment, and these CAR T-cells only can work with efficiently with the hematological tumors. And of course, you can work with solid tumors too, a little bit differently, but the most important problem is the so-called on-target off-tumor effect, which basically kills healthy cells, which is not good for us.
May I ask you something? I know that you are a biologist. How difficult to synthesize such a CAR T-cells, or it will be available to do here in Hungary, for instance? We have access for this. Is it a complicated method? You introduced an interesting figure about this, but it was too short time to analyze that.
Should I go back?
Yes.
Show it? This is, I already worked with it in a lab. They do it, for example, in Department of University. And it's not that difficult, but it's, you always have to check that one of the steps worked well. So the diagnosis, the testing is making it very expensive sometimes. But in vitro and in vivo tests could be available, of course, in Hungary too. But the therapy is still expensive. So what you can see here is this part is affecting the cells inside. It's making the signal transduction. And this is just an antigen. It can be very well it's very well changeable. and it just has a spacer part of matching them together. And sometimes we use co-stimulators, which make these CAR T cells more effective. But it's originally constructed from different natural immunological molecules. It's like a Lego from the original one.
So can you tell that this is a so-called cellular biological therapy?
Yes.
Because we use in everyday this humoral biological therapy, and this will be the cellular, because it will be able to go just that place where its function will be necessary.
Yes.
Yes.
It will, and but the lymphocytes are very effectively do that naturally too. So, and it works very well.
But they can selectively kill the bad guys.
Yes, the selection depends on us. What kind of antigen we give it.